Yeah, we're all screwed. This is gross. No, like, really. So, with health insurance prices, all right, the premiums of the average health insurance costs went up 26% from last year's rates. And on top of that, the average like premiums went up by hundreds of dollars for people. Like, it's insane. Like, seriously, it's messed up. Check this out. I'll show you an example. So like the average household income is like 62,000 a year for a single person. So let's say you got a 38-year-old guy and he makes 65K. Not a lot of money, okay? This is how much the insurance prices are. Check this out. 38 years old, 65K income. All right. You probably never even heard of this plan, Oscar. This is a silver plan. No. Let's go cheaper. Let's go cheaper and go to like catastrophic, terrible insurance right here. This is the cheapest plan you can get. $461 a month. $9,000 deductible. $10,000 out of pocket max. HMO network on a carrier called Oscar. That's like $5,500 a year just on your premiums. Okay, this is like, for this person, it's like 20% of their net income now has to go to health insurance. Like, to look at the plan year of 2025, this is what it would have been. He could have got a cheaper plan, $345 at least at a 65K income. It still sucks, okay? But this is just, what is that, $130 more a month for this guy? It's nuts. Imagine you got a family. You know what I mean? Like, imagine. All right, let's get into some of these clips and see what's going on.
I just logged in to our health insurance provider and I can't even... In July of 2025, our health insurance premium went from $59 a month to $798 a month. Mm-hmm. And since it is now open enrollment, I just logged in to our health insurance to see if we stay on the same plan, what our premium is going to be for 2026. $1,208.91.
So what happened to him is what's happening to like everybody. They changed the amount of income you could have to receive a subsidy. So they were probably on the cusp. They made just little enough to get a real nice reduction based on their income. And since that changed, you have to make even less money to get any subsidy. Now they're paying full price because they no longer qualify because they make 4 times the federal poverty income limit. For people like that make too much money, the only way you can save is if you're healthy. Like, if you're unhealthy, you're just totally screwed. Like, for real, you are. But if you're healthy, you can get plans that'll give you reduced rates based on your risk to the carrier because you're healthy. Those are private plans. But not everyone can qualify for those because they have things like diabetes and Crohn's disease and cancer history or whatever. But, you know, if you're pretty healthy, you can probably get some savings. Wow, things just keep getting better and better, don't they?
For health insurance, it's its own kind of torture because not only do I not understand what half of this stuff means, it's also very expensive. So my husband and I are self-employed. So this time we're going to get a small group health insurance plan. So it's not through the marketplace. And it costs a pretty penny. Right now I have 2 options. I'm considering between the silver and the gold. Both of them are a PPO plan and both of them have an HSA, so that's great. The premium for the silver is $1,038 and for the gold is $1,201. And this is the amount of money we pay every single month and never see it again. The deductible for the silver is $15,300 and for the gold is $5,200. And this is the amount of money we need to pay before insurance even kicks in. So obviously the gold is better. Now, the out-of-pocket max for the silver is $18,400 and for the gold is $10,500. $500. So this is the maximum we'd pay in the year. A lot of people say that if you don't go to the doctor a lot, you should just choose the lower premium one, so aka the silver. However, though, isn't that the point of health insurance? In case there's like a major accident, you don't pay a whole ton of money. So here's where the gold makes sense.
Yeah. Neither of these options look good. The problem for this lady, though, is like she's a business owner and she's doing this group plan. Group plan insurance is good if you have more than 50 employees, because then you get a discount. These are full prices. I mean, for self-employed, dude, just try to do individual plans. I mean, there are ways to save money other than like income-based plans, but dude, 15,000 deduct, 18,000 max. What are we talking about?
Okay, so open enrollment is coming up, and we're clearly very qualified to be talking about this.
I am. I'm a genius.
We're trying to figure out if we want to cancel our insurance and pay out of pocket or keep insurance. Bottom line is we're canceling insurance. How much are we paying per month for insurance?
For me and Beckham, it's about $550 a month.
Okay, so we've done all of our research, and Tyler's going to share it with you.
Oh, yeah, me. Just for like a typical blood panel that I have to do every year for insurance through work is $280. Like a women's hormonal test, that would be $289. With insurance, it cost me $190 go in to do an EKG, which took a minute. I could have just done an echocardiogram for $280. The comprehensive panel.
They have sales!
$308 typically, $281 on sale.
Okay, so if it's just like a random Tuesday and
I had no idea they do sales on imaging.
you feel like you're kind of getting the flu or something, you can go to Amazon One Medical is $50, Texas Health Breeze is $50, or $205 if you go in office. If you go in office to Texas Health Breeze, they can do x-rays and COVID testing, things like that, just a little bit more comprehensive versus your telehealth medicine. Call on doc, same thing, $30 a visit, or you can pay $45 quarterly, and then it's only $15 every time you need to call them. For children, Blueberry Pediatrics is $30 a month, or it's $216 a year plus a one-time fee for the kit. But I have a code for that if you need it. Both of those are 24/7. We've had Blueberry since Beckham was born, and it's been a lifesaver. I will have that for the rest of my life as long.
Look, honestly, I know I've talked about this before, but like if you guys are like these people that have to do all of these number crunching and all that because your insurance is so expensive and you're like, we should give it up, just go to healthnerd.net. It's been saving people like 30-40% on their insurance. Not everybody can get these plans that they offer, but for the people that can, which is a lot of people, 30 to 40% savings. You could probably pay cheaper than you're already paying for 2025, not even including how high the insurance is going. And nobody calls you anyway. You just get a quote and you can talk to them if you want to. It's way better than like, don't put a quote online. You're going to get 100 calls.
I think it's time. I think I'm going to cancel my health insurance because this is getting ridiculous. I went in for my yearly with like a new primary care physician. Actually, she was a nurse practitioner. But anyway, I got my panels drawn, and the next day, one of the people in the office calls me, and she's like, "Hey, don't panic. The doctor thinks you have like this like benign blood disease or something. So come in tomorrow so we can get some more blood to test you again." So I come in, get my blood drawn again. I'm freaking out, even though she told me not to, because what? Blood disease or disorder or whatever. So anyway, so I wait because she told me that she does her follow-ups all on Thursdays. And I'm like, okay, cool. Mm-hmm. So a couple days go by and I'm still freaking out. Thursday comes and it's a virtual appointment. I get on the Zoom link and some like virtual assistant pops up. So she's like, okay, so you're here to talk with Dr. So-and-so so she can go over your labs with you. I'm like, yeah. So she was like, that'll be $70. $70 for her to tell me what my labs mean? Like, I've never been in a situation like that. Anytime I've gotten my like blood drawn, they'll just call me and like, hey.
They're charging her basically like an office visit cost to tell her what her blood results mean. At that point, I would just pull up the paper, put the numbers into Google, and see what it means.
This is normal. Maybe work on this, yada, yada, whatever. So I'm just like, I'm confused. Like, is this like another visit? Like $70 for her to tell me what my panels mean? So I'm like, nah, cancel that. Like that's crazy. I feel like I'm entitled to have, my panels explained to me, especially if there's some type of diagnosis. So she's just like, okay, I'll let the doctor know. And I was like, well, can you let her know, like, put some notes in the little virtual website thing that they have, the portal, like the medical portal.
Yeah.
So this lady has the nerve to get on there and send me a WebMD link because she thinks I have this blood syndrome. And I'm like, are you serious? Like, you can't even give me a call to like explain anything to me unless I pay you. Like, am I tripping?
No, you're not. They don't care about you. They care about making their money. That's what they care about. It's disgusting. You pay all this money. Average income's not going up. Credit card debt's going up. Bills are going up. Groceries going up. So is insurance. And now nobody cares about you. They just want your money. Like and subscribe, comment. We'll have more fun on the next one.